Hello, and welcome to Healthy Start. This video, revealing the top 10 signs and symptoms of prediabetes, could be the most important one you ever watch. Why? Because prediabetes, also known as insulin resistance, is the single greatest hidden health threat in the world today. It affects about 88 million people in the United States alone. While the US leads in this epidemic, the rest of the world is catching up fast. Let's dive into why this matters so much and how you can spot the warning signs before it's too late. First, let's understand insulin resistance. It's not a condition you either have or don't have. It's a gradient, a scale that shows where you stand. To measure this, we use hemoglobin A1C, a powerful indicator of your average blood sugar over 3 to 4 months. Here's how it works. Everyone has blood sugar, and some of that sugar sticks to your red blood cells. Since red blood cells live for about 3 to 4 months, measuring the sugar stuck to them gives us a clear picture of your blood sugar levels over that time. A normal A1C is around 5.0. According to official criteria, anything below 5.7 is considered normal. If your A1C is between 5.7 and 6.5, you're in the pre-diabetic range. Above 6.5, you're classified as having type 2 diabetes. In the US, 88 million people are pre-diabetic, and 35 million have full-blown type 2 diabetes. Here's why they call it prediabetes. Statistically, about 75% of pre-diabetics will develop type 2 diabetes, typically within 5 years. That means 66 million more people could become diabetic in the near future. The diabetic epidemic we're seeing now is just the tip of the iceberg. If we wait until we're officially pre-diabetic, we're missing the chance to act earlier. An optimal A1C is up to about 5.3. Based on this, I estimate that around 75 million Americans have optimal glucose tolerance and handling. That leaves roughly 150 million people who are slipping toward prediabetes. They're eating the standard American diet, processed foods, sugar, white flour, and moving down this dangerous path. Unless they change, they're on track to join the 300 million Americans with some degree of glucose handling issues. That's almost everyone you know. The most common way prediabetes is diagnosed is through blood sugar levels. If your fasting blood sugar is between 100 and 125 milligrams per deciliter, or your A1C is between 5.7 and 6.5, you're prediabetic. Shockingly, 90% of the 88 million prediabetics don't know they have it. Why? Because we focus too much on blood sugar. The body works hard to keep blood sugar in a narrow range. It's critical for energy, focus, and brain function. Multiple systems in your body raise blood sugar when it's low and lower it when it's high. Because it's so tightly controlled, we only see changes when the system has completely failed. You might get blood tests year after year that say, "You're normal. Come back next year." 10 or 15 years later, nothing seems different. But the real story lies in insulin. Insulin is how your body keeps blood sugar in check. If we measured insulin levels, we'd see how hard your body is working to maintain that balance. In the early stages, glucose and insulin might be in harmony. A few years later, you could have 2 to 3 times as much insulin, but the same glucose level. Your body is working twice as hard to keep blood sugar down. If we only measure glucose, we miss this. Over time, 9, 12, or 15 years insulin levels can climb dramatically. A normal insulin level is about 3 to 5, but by the time someone is diabetic, it could be 25. Glucose changes slowly, only spiking when the system fails. Insulin, however, shows a steady increase, revealing where you are on the scale. Official insulin criteria range from 2.6 to 25, a tenfold difference, while glucose stays in a tight range. Measuring insulin would catch prediabetes much earlier. Now, let's talk about the second sign of insulin resistance: elevated fasting insulin. This should be the top sign, but it's rarely measured. If your doctor isn't checking your insulin levels, you're missing a key piece of the puzzle. Sign number 3 is fatigue, especially after meals. When you eat, food should turn into energy without much effort. After a big meal, you might feel relaxed or slightly tired, but severe fatigue that disrupts your day is a red flag. It means your carbohydrate processing system is broken. Over time, You've overwhelmed it with too many carbs. Now, your cells resist insulin, a hallmark of insulin resistance. Instead of providing energy, carbs force your body to use energy to dispose of excess glucose. This process converts glucose into triglycerides, raising blood fat levels. That's why some people on low-fat diets have high triglycerides. Sign number 4 is poor wound healing. If a cut lingers for weeks, it's a warning. Sign number 5 is numbness and tingling, caused by peripheral neuropathy. These two share a common cause: poor circulation. Excess glucose leaks into surrounding tissues, binding water and causing swelling. This swelling hampers blood flow, slowing healing and causing odd sensations. In early stages, you might notice things happen more slowly or feel strange. If unchecked, this can lead to severe outcomes in type 2 diabetes like amputations. Type 2 diabetes is the leading cause of amputations, and while prediabetes won't cause this, catching it early is crucial to stop the progression. Sign number 6 is kidney damage, tied to microvessel disease. Your kidneys have countless tiny blood vessels. Swelling from excess glucose causes leaking and destruction of these vessels. If caught early, this damage is reversible. If ignored, it can lead to kidney failure, the top cause of dialysis in type 2 diabetes. Sign number 7 is blurred vision, caused by retinopathy, a disease of the retina, the light-sensitive area at the back of your eye. Tiny blood vessels in the retina swell, damaging it. This starts with blurred vision and, if untreated, can lead to blindness, the leading cause of which is type 2 diabetes. Don't let it get that far. You might hear about frequent urination as a prediabetes symptom, but that's not accurate. Frequent urination happens when blood sugar exceeds 180 milligrams per deciliter, far above the pre-diabetic range of 100 to 125. At that level, the kidneys can't reabsorb the sugar, so it's filtered out with water, causing thirst and urination. This is a sign of poorly controlled type 2 diabetes, not prediabetes. Similarly, digestive issues are often linked to prediabetes, but they're not a direct cause. They're associated because the same poor diet high in carbs disrupts your gut bacteria, leading to bloating and discomfort. Fixing your diet can help both your gut and your blood sugar. Sign number 8 is joint pain and arthritis. Many people think their weight causes knee or back pain, believing that losing weight would fix it. That's a myth. Insulin resistance causes inflammation, which triggers joint pain and arthritis. Both osteoarthritis and rheumatoid arthritis are inflammatory conditions, with osteoarthritis being milder. Insulin resistance also leads to weight gain, our 9th sign. Insulin's job is to lower blood glucose by guiding it into cells. A small amount is stored as carbohydrates, but most is converted to fat. This is why people with type 2 diabetes, treated with extra insulin, often gain weight. The treatment focuses on blood sugar, not the root cause, making both diabetes and weight gain worse. The 10th sign is hunger. Even as you gain weight and store more fat, you feel hungrier. Why? Insulin resistance puts your body in storage mode. You have plenty of energy stored as fat, but you can't access it. Instead, you keep storing more, feeling hungrier despite the extra weight. This cycle explains why calorie counting often fails. It's not about calories, but insulin and insulin resistance. 2 final points to understand. First, you don't always gain weight with insulin resistance. Many thin people develop prediabetes or type 2 diabetes, often with a slight pot belly due to liver fat. Second, while prediabetes is a massive health problem, it's not the only one. For most people, it accounts for about 80% of health issues, but other factors can play a role. Don't assume everything is tied to insulin resistance, but it's a great place to start. In conclusion, prediabetes is a wake-up call, but it's also an opportunity. By recognizing these 10 signs: elevated insulin, fatigue, poor wound healing, numbness, kidney damage, blurred vision, joint pain, weight gain, hunger, and more, you can take action early. Change your diet, reduce processed foods, and talk to your doctor about insulin testing. This video could be the first step to reclaiming your health. If you found it valuable, please save it, share it with someone you care about, and subscribe to Healthy Start. Hit that bell and turn on all notifications so you never miss a life-saving video. Together, we can beat prediabetes and build a healthier future. Thank you for watching.